afternoon, everyone. I'd like to welcome everyone to the Burke County Board of Commissioners special meeting held Tuesday, October 3rd here in Chambers, 2023 at 2:30 p.m. Madam Clerk, we have Commissioner Smith, Commissioner Burns, Vice Chair Britton, Commissioner Carswell, our County Finance Officer, our County Attorney, and our County Manager all in attendance, ma'am. I would remind everyone to please silence their mobile devices, and I would ask all speakers that come to the lectern to make sure the microphone is activated so those folks can be heard on the YouTube recording, please. Gentlemen, at this time, I will ask for approval of the agenda. You've had a chance to review the agenda. What is the pleasure of the board?
Mr. Chairman, I move to approve the agenda as presented.
Thank you, Commissioner Burns. All those in favor signify with uplifted hand. Madam Clerk, that carries 5-0. That brings us to item number 3. We have 2 items for decision today, gentlemen. First, health resolution directing expenditure of opioid settlement funds for next one, presented by Katie Varnado, Human Services Planner. Katie, how are you?
Is it on? Okay.
Yeah.
It is with sad news that I bring this resolution to you. Last week we received notification from DHHS that in the past month overdoses in Burke County have significantly increased, and we've seen a 6-month increase in ED presentations for opioid-related overdose of 73%. So when we received that news, we knew we needed to act swiftly. And I'm bringing this resolution to you today for the expenditure of opioid settlement dollars to purchase naloxone for community distribution. This is a downstream effort to save lives and prevent fatalities from overdose. Naloxone is an antidote medication that is administered either intramuscularly or nasally to reverse overdoses. And this is something that we can do now and get out in the community now so we can help save lives. So this resolution it follows the requirements of the NCMOA for the expenditure of $10,000 for the purchase of naloxone.
Thank you, Katie. Gentlemen, comments? We'll probably have several. Questions?
Mr. Chairman, where will these doses be distributed?
So we'll work with our community partners to create a distribution plan to the communities. Right now in the health department, we have requests from volunteer fire departments, community agencies, and the community at large for naloxone. So we'll work with our community partners to come up with a distribution plan to get it out in the communities and businesses and in the hands of families and individuals that may need it.
Okay, thank you.
Thank you, Commissioner Burns. Other comments, questions?
Thank you, Mr. Chairman. Katie, we've been doing just a miraculous job, I think, in the opioid arena, but I am concerned that all of a sudden we get a lot of urgency from DHHS saying we're 73%. Why did they not contact us much sooner about the overdoses? And I think that moves Burke County kind of to #1 spot, does it not?
So I'm assuming that they're using NC Detect and they're getting the information at the end of the month. So whatever algorithm they were using sent a flag to their analyst, and then that triggered an email to come to the health department to make us aware of that. Another effort that we're doing now is around our data management, as we're looking at developing an overdose fatality review board that will collect that data in real time. So I have some EMS data for the last month, and EMS is responding to about 1 overdose every day, and there were 2 fatalities last month from that, according to the EMS data. So what we want to do with the overdose fatality review board is compile all of the available data that we have and get really a local real-time perspective on what's happening now instead of being reactive and waiting for someone else to notify us. So we're making progress toward being innovative in our data collection.
Well, I agree. I think it's a reactive approach. I think BSAN has done an extremely good job of making sure naloxone is distributed throughout the county. I think our EMS has done just a yeoman's job making sure there's plenty of Narcan on the vehicles themselves. Our sheriff's department, and police departments, local police departments have Narcan in their vehicles to use when necessary, but it still burdens me really a lot to find out we got a rise of 73% and we're finding out about it this week. I understand that's nothing that you can answer, but coming from DHHS, again, I want to find out, they should be giving us some information as to why there's a 73% increase so that we can tackle it from that. It's great. This applies to my presidential initiative of one more thing. I don't mind giving the $10,000 and using the Narcan, but I would like to grab a hold of why. Give me the why of why we're 73% and we didn't know about it before this week. That's the only question I've got. Like I say, you're probably not going to be able to answer it because the information just flows, and it came into the health department, and here we are. Mm-hmm. So, I'm trying to find another avenue of how we gather data locally, either through BSAN or either through the other entities that we have here, as to how we can get 73% cut down. You understand where I'm coming from with this, okay? I think it's a legitimate question to ask why today.
And like I said, naloxone is a downstream intervention, which means that we're reacting to something that's already happening. And when we establish something like the overdose fatality review, we'll be able to look at a case-by-case basis and determine the exact root causes of what's happening to cause people to overdose, and then develop recommendations from that. So the purchase of naloxone is just one of the one more things that we're doing to start with, to position ourselves to be able to respond before we have fatalities.
It just irks me that we come up with the presidential initiative from the association, and then we turn around and the president's own county has the problem. I mean, I want to solve the problem, obviously, and all 100 counties have the problem, but I really didn't think we'd be up to 73%. I'm going to stop, Mr. Chairman. This will go nowhere, but I just want to make some points and get it into the public record that I am concerned how we got to 73% and we didn't know anything about it until recently. So that's my points for today.
Mr. Chairman, I think maybe it would bring some clarity to the issue if we understood what 73% is.
So 73% was the rate of increase of emergency department presentations for opioid-related overdose.
But 73% of 10 is a whole lot different than 73% of 1,000, is what I'm getting at. So what constitutes 73% in terms of real numbers?
It was from, and this is an approximation, I think the original number was 11, and then it went up to 17 or 20.
Okay.
But that is something that we will be able to track in real time through our overdose fatality review.
Well, I think to Commissioner Carswell's point, I have a hard time sometimes with percentages, because percentages can paint a really bad picture of, or a really good picture of something that is really manageable. Like I said, 73% of 10 is a lot different than 73% of 1,000. So if we could see, I don't mind seeing the percentage, but going forward, if we could see the numbers, that I think would help me.
Sure, absolutely. And even if the number is, if it's a low number, it's still one, even if it was one person, that's still.
Chairman. Katie, how many doses will $10,000 buy?
So Narcan or naloxone right now is about $80 for the nasal per 2 doses in a box. So we would be able to purchase around 800 to 1,000.
Okay. I know your number here is aimed at fatalities, but I think most of us realize that one fatality probably equals 10, 20, you tell me, overdoses that don't end in fatality.
We know that one overdose, whether it's a fatality or not, equals about 5 hospital emergency department visits. So last month, our total number of EMS calls was 30 with 2 fatalities.
So what happens with those folks that have an overdose but that do not die? What follow-up from a sheriff's department standpoint do we have to dig into where did that drug come from? Any idea?
I'm going to have to let the sheriff's department answer that one. I can speak from a public health perspective. We have, we're working with EMS and community paramedicine, so the community paramedic is able to respond to some of those and then link individuals to resources and treatment. From the sheriff's department perspective, I think I'll have to leave that one up to them to comment on that.
I think most of us have probably heard the news lately where we're putting more and more teeth into laws that point toward those folks that actually distribute, or where did the drugs come from. Mr. Manager, maybe we could entertain a time with the sheriff to discuss better how to follow up on these cases and put something together to work from that perspective as well.
Happy to. One other just hopeful predictive analytic that we're trying to put together, talked about it as recently as today, is extracting 911 emergency service dispatch data, mapping that out and seeing where our hot spots are, so that we could potentially, whether it's law enforcement or public health or what, but deploy our resources in a strategic way. Likely there's patterns about proximity and geographic location, neighborhoods, social demographic, social determinants, all those things. It's not an equal distribution, I'm sure. And so it won't take us long to do that. We want to be part of the solution, be part of the team. And I agree. Understanding all the aspects, including specifically prevention of distribution, is a critical component.
Mr. Chairman, one more thing, if I could. So when Narcan or Naloxone, whatever that word, when it's administered, do we know if it was administered to a non-drug user, or do we have separate numbers to talk about those doses that are administered to caregivers or deputies, or do they count in the 73% of? So does the 73% come from doses given, or where does that number come from?
The 73% is the increase in the number of people that
Overdose, whether they were a caregiver, a sheriff's deputy, or a drug user.
Well, they were individuals that had overdosed from opioids and then gone to the emergency department. So that was specifically emergency department data of people that were coming in and being treated for opioid overdose.
Okay, because I was kind of curious about that, if I'm not mistaken, and if there's media here, don't quote me on this, but I think there were a total of 4 doses issued at the sheriff's department last week for 2 different officers. I know that those officers were transported to the ER. So were they counted? I guess I'm trying to understand, how are they counted? Are they counted differently, or are they counted, does it all go into one pot?
It's usually those metrics are pulled from billing codes. So if a person presented and was experiencing overdose symptoms, they would all be coded the same. So
Okay.
if there were officers involved in that or helping professionals, they would also be included in that number.
Okay, thank you.
We have a major problem about the analytics, as the county manager said. Where are we getting it from? Are we depending on the state to give it to us, or are we depending on ourselves to give it to us? Looks like we may be doing a better job ourselves if we're tracking data through 911 and other places to give us a little better advantage of trying to put a handle on the problem here at the house before we hear it from the state. That's bothered me for a long, long time, is to hear the state come in with their numbers, hear somebody else come in with their numbers, and we probably know what our numbers are here. So it presents a problem, and I don't know how we address it, or do we want to address it here in the county first with trying to get new analytical data at home. Speak to it if you like.
Well, I can tell you that we have it real time available. It is fluid. If someone requires any pre-hospitalization care, if they're going to the emergency room and they don't take themselves and they call 911 and they require EMS support, we have that. And you know, I'm envisioning a map again that kind of shows the proximity for where these come in, and then the conversation becomes, what do you do about it? Is it increased surveillance, law enforcement, prevention of distribution? Is it a more mobilized treatment, marketing, communication? You know, what do we do? Where do we deploy our resources? And I do think that, like you, Commissioner, I didn't know anything about this until I got the phone call last week either. And that's a product, as Katie said, of 30 days late information coming from the hospital to the state back to us. So trying to be more prospective with that, I think is critical. And there are models. I think the overdose task force is a critical component, but I think that the most important thing that we can all commit to and say out loud is, whether it's the public health department or the hospital or EMS or 911 or the county manager's office, that everybody openly and willingly and fluidly shares information in a way that gives us some indication of where we should be looking and to try to prevent it. I think that's the key, and I'm not sure that's what's happening around the state. I think we can do a better job of it here, and I think that we have the resources to do it. This is just a very rude awakening that we should be doing a better job of it.
Ma'am, excuse me, what is the shelf life of naloxone? How long does it last after we purchase it?
I believe that it is about a year.
About like going to CVS over here, isn't it? Then?
So Katie, were there any similar spikes across the state?
Not that I'm aware, but I was only privy to the email about Burke County, so
Okay.
that's.
I know it's new information, so maybe word of mouth hadn't gotten
Yeah.
around. This could be a pattern that it's not only us, but maybe other counties. I was just interested because, you know, we seem to be in a real areas, and Johnny and all of us know that, you know, this particular area in the foothills just seems to be particularly prevalent for this. And so I was wondering if we had any similar data from surrounding counties. I'd just like to know that at some point, if they're seeing similar spikes. Gentlemen, any other questions or comments for Katie? And what's the pleasure of the board?
Mr. Chairman, I make a motion to approve or adopt resolution number 2023-21.
Thank you, Commissioner Burns. All those in favor signify with uplifted hand. Motion carried 5-0. Madam Clerk, Katie, thank you so much. Gentlemen, that brings us to decision number 2, selection of contractor for the Jonas Ridge Waste and Recycling Convenience Center completion project. This will be presented by Brian Epley, our county manager, and Mark Delahunt, our general services director. Mark, how are you, sir?
Good, real good. Good afternoon, Mr. Chairman, members of the board. As you're aware, and if you would cue up the PowerPoint slide, please. Okay, next slide. Next slide. There we go. As you are aware, in June of 22, the county purchased property in Jonas Ridge for the construction of a new convenience site and a community center. The current convenience site has been in operation since 1996 and is in need of an update and additional space. Thus, a plan was developed to construct a modern convenience site and a recycling center that will last us for many years to come. Next slide, please. So I just noticed I have the clicker here, but thank you, Scott. Although construction of the project was originally bid in December of 2022, due to contractual challenges, it became necessary for us to rebid the unfinished portion of the project and the design build procurement model was selected for that purpose. Selection criteria was, let's see. Selection criteria was developed in an RFQ. An RFQ was advertised and a team consisting of county staff was put together to select a qualified contractor to complete the project using the criteria listed on this slide. And this is the score sheets that came as a result of that. Of the three firms interviewed, although the scoring was very close, as you'll see, a company out of Hickory named Moss Marlowe scored the highest based on that criteria. And I've spoken to Moss and Marlowe since then and let them know that we would be requesting that the board provide approval to the county manager to enter into contract with them. Based on that conversation, they're ready to hit the ground running as soon as the contract is in place. In fact, they plan to begin the additional grading the very next day once the contract is in place. Moss and Marlowe is also, as you may know, the contractor for the East Burke site, which is going very well. Talked to them today regarding that as well, and they plan on digging footers today and pouring concrete, maybe even this week. With that said, I'm before you today request that the board authorize the county manager to negotiate and execute a contract with Moss and Marlowe to complete the construction of the Jonas Ridge project. And I'd be happy to try and answer any questions you may have.
Thank you, Mark. One quick question. I know at one time we had said that project was initially about 50% complete. Is that still roughly where we stand? I didn't know there was going to have to be additional grading. I thought most of that was already done. So.
I think the grading I spoke of is more or less a cleanup from the delay and the weather that we've had since the time that we closed it out temporarily.
Go back one slide, Scott and Mark.
To
I would say the project hasn't had movement since June the 28th. That's the day that the previous contractor vacated the property. So and to remobilize, it's going to be early October. So you're looking at a 90 to 100 day delay, and that's about where we are from the original completion target. We feel very confident, and this was the team that interviewed the three firms. That were scored, all were very meticulous in covering this proposed schedule. So we feel very confident that substantial completion no later than January 31 with a targeted soft opening. And when we say soft opening, that means everything's operational other than maybe asphalt in December. So all that being said, I think at least 50% of the project is complete. McGill and Associates, who was the original design firm, has updated that project completion design scope. Moss Marlowe's been privileged to that, and we feel good about this calendar this time of month.
So you're very optimistic about the weather.
Moss and Marlowe, that came up in the discussions about the weather.
I assumed it did, and that's why they had to have some bit of a factor in there, knowing the conditions that go on up at Jonas Ridge.
There's a lot of advantages to Moss and Marlowe being the East Burke contractor already. Much of the purchases that were made for that building, the building at the Jonas Ridge site is identical. So a lot of the red tape is selecting whether it be color or this, that, and the other is going to be identical. And they get a really leg up as far as time goes.
Gentlemen, questions? Sorry about that. Comments?
Where do we stand at on, tell me how much money we'd already paid, how much money we were going to pay, and now how much money are we going to pay to finish up?
Let's see, I have some notes
Total
on
project cost, Johnny, was about $1.6 million. 1.3 of that was for construction. There's about 800 of that left.
remaining, yeah.
So the point of today is the next step in this design build methodology procurement model will be to negotiate a GMP, a guaranteed maximum price. And we wish to advance that with original already appropriated dollars. If that guaranteed maximum price can't be negotiated within that, but it's at a reasonable number, we'll have to come back and ask for an additional appropriation. We're hopeful that that isn't the case, but I would remind you there were only 2 bidders last fall. The awarding contract was 1.6, the next lowest was 1.9, so it was a $300,000 difference on a $1.6 million project. So that should have been a red flag, I think, to us. That likely was too low of a bid. And you have to factor in order to hit our timeline, there may be overtime and there's remobilization cost. So we're eager to get started. We think that we are in a good spot to re-engage with existing appropriations. But if the GMP goes over the $800,000 that's left, we will have to circle back and ask for more.
Questions?
So Brian, does that mean if the project goes over budget, you'll come back to this board for approval to go forward? Is that
That's right. Yes. And I would, again, point out that there was a pretty significant variance between bidder 1 and bidder 2 in the first one, and we are picking up somebody else's work, and we are remobilizing very quickly with a condensed timeline. So we're going to manage that the very best way we can. I simply say all that to say there's enough to get started, and we're hopeful that that will be sufficient for project completion, but we don't know that to be 100% accurate at this point.
Do you think we'll have those numbers by our regular meeting?
I do.
Gentlemen, any other questions, comments? I just want to say on behalf of the board, Brian, staff, Mark, all of you, going back and get this with the snafu that happened. We appreciate y'all expediting this project and keeping it on the rails, because this could be a significant cost increase if this were delayed a year. So I don't know where we'd stand, so on behalf of the board, thank you for expediting this process to keep us on track. Gentlemen, what's the pleasure of the board?
Chairman, I move to authorize the county manager to negotiate and execute a contract for design build services with Moss Marlowe Building Company Incorporated for completion of the Jonas Ridge Waste and Recycling Convenience Center, subject to review and revision by the county attorney. If an agreement cannot be reached with the recommended firm, then the county manager is authorized to negotiate a contract with the second or third ranked firms.
Thank you, Vice Chair Britton. All those in favor of the motion signify with uplifted hand. Madam Clerk, that motion carried 5-0. Thank you, sir. Thank you. Gentlemen, that concludes our business for a special call meeting. We have a motion to adjourn.
So moved, Mr. Chairman, with 2 minutes to go.
Thank you, Commissioner Burns. All those in favor signify with uplifted hand. Madam Clerk, motion carries 5-0.